I call the member for East Hills.
Thank you, Madam Speaker. I rise today to speak in my capacity as the Chair of the Community Services Committee. I put that the House takes note of the report of the Community Services Committee that I tabled in November 2020 entitled The Protocol for Homeless People in Public Places. The Protocol for Homeless People in Public Places, the protocol, was developed by the New South Wales Government in 1999 to ensure people sleeping rough are treated respectfully and are not discriminated against because of their living situation. The protocol outlines the rights and responsibilities of people sleeping rough and can direct them to support services if they require or request them. In May 2013, the guidelines for implementation were published to assist signatory agencies with implementing the protocol. While Housing New South Wales was the lead agency for coordinating the protocol then, it is now managed by the Department of Communities and Justice. The committee embarked upon an inquiry under the terms of reference, and as part of this inquiry, the committee received a total of 35 submissions. These came from the community, service providers, local councils and the New South Wales Government. The committee also held 2 public hearings at Parliament House in August of 2020, with witnesses representing the service providers, local councils, New South Wales Government and those with a lived experience of homelessness. In addition to submissions and evidence at the public hearing, members of the committee had the opportunity to join me in a visit to Belmore Park near Central Station to witness first-hand assertive outreach in the field, giving committee members valuable insight into the plight of those who experience homelessness and the agencies who serve to help them. I wish to thank the Minister for Families, Communities and Disability Services, the Honourable Gareth Ward, for joining us on that assertive outreach visit and his staff for organising it in conjunction with the other agencies who were there on the day. The site visit and the hearings presented the opportunity to meet a number of relevant stakeholders and get first-hand experience and insight into some of the issues raised during the inquiry. Overall, stakeholders told us that the protocol was a valuable tool to give guidance for appropriate and constructive interactions between public officials and people sleeping rough in public places. However, it was also reported that the protocol was not used consistently across the state and across agencies. Therefore, we have recommended that a mechanism be put in place to make agencies more accountable by demonstrating how they are implementing the protocol. The inquiry began just before the start of the global pandemic, and since the COVID-19 outbreak, the New South Wales Government has spent more than $70 million and expanded programs to help support some of the most vulnerable people in our community. 850 individuals and families have received assistance to rent homes in the private market. More than 1,900 individuals and families who were homeless or at risk of homelessness have been moved into social housing since April of last year, including more than 230 rough sleepers who had spent time in temporary accommodation such as hotels. Throughout the inquiry, we heard positive reports on how government agencies and non-government organisations had worked to provide enhanced support to people experiencing homelessness in response to the COVID-19 pandemic. This work helped to keep people sleeping rough, safe and housed throughout the crisis. Having considered stakeholders' input, the committee has made 23 recommendations that we are confident will enhance the protocol and make it fit for purpose to meet the contemporary needs of people sleeping rough and the agencies and organisations that use the protocol. Local councils are often one of the first points of contact for people sleeping rough. As such, we have recommended that local councils be given the opportunity of becoming signatories to the protocol. Similarly, the protocol should include specific guidance on appropriate responses to various vulnerable groups of people, including Aboriginal and Torres Strait Islander people, women, people with disability and young people. We have recommended that consideration should be given to including reference to the appropriate child protection provisions for children under 18 years of age who are sleeping rough and guidance on appropriate responses to people under 24 years of age who are sleeping rough. The value of the protocol can be further enhanced by increasing awareness around it. While we heard that it was well used by a number of agencies, there was less awareness of it amongst the general public and people experiencing homelessness. As noted in the report, the committee heard about the good work and increased collaboration between government and non-government support services in response to the impacts of the COVID-19 pandemic and on people experiencing homelessness. I would like to commend these service providers for their amazing work and hope the spirit of collaboration continues long past the pandemic. The protocol is something that has served the community well over the years, and I'm eager to see how it develops now to continue to meet the needs of the community. I hope that the government will consider the committee's constructive recommendations as part of this process. Again, I wish to thank the Minister for Families, Communities and Disability Services, Gareth Ward, and his staff. And I would also like to thank the other members of the committee, who many of them are here today, for the collegiate way we work together on this important issue. I'm also grateful to the Legislative Assembly Committee staff for the expertise and professionalism they applied in assisting the committee throughout the inquiry. I commend the report to the House.
Madam Speaker.